Hello, everybody, and welcome back to Plugged into Public Health. When we think about barriers to health, we often think about access to doctors, medications, or healthy food, but millions of people face another barrier that receives far less attention: access to menstrual products. Period poverty isn't just about affordability, it's also about stigma, accessibility, and whether schools, workplaces, and public spaces are equipped to meet a basic health need. Today we're joined by Maanya, a University of Iowa public health student and founder of Love for Red, a nonprofit organization working to combat period poverty across Iowa through service, education, and policy advocacy. What began as a project started by a 15-year-old during the pandemic has grown into a statewide nonprofit providing menstrual products to schools and community organizations while advocating for lasting policy change. In this conversation, we discuss what period poverty actually looks like in everyday life, why access remains a challenge even in communities with available resources, what it takes to build and sustain a nonprofit organization, and how policy can help create long-term solutions. I'm Lauren Lavin, and if it's your first time with us, welcome. We're a student-run podcast that talks about major issues in public health and how they are relevant to anyone, both in and outside the field. Now let's get plugged into public health. Plugged into Public Health is produced and edited by the students at the University of Iowa College of Public Health, and the views and opinions expressed in this podcast are solely those of the student hosts, guests, and contributors. They do not necessarily reflect the views or opinions of the University of Iowa or the College of Public Health. Thank you, Maanya, for joining the podcast today. To start, could you introduce yourself, who you are, what you do at the University of Iowa, and then I also have you introduce your organization, Love for Red.
Yeah, so my name is Manya. I'm a fourth year student at the University of Iowa, majoring in public health on the pre-med track. And I'm also the founder and president of Love for Red. And Love for Red is a 501(c)(3) nonprofit organization. And we are based mostly in Des Moines, but we also had an Iowa City team while I'm in undergrad. But our main mission is that we work to fight period poverty in Iowa through service, advocacy, and awareness.
Fabulous. And an official 501(c)(3). That's not a small feat.
No, yeah, that was a really big deal when we got it. It was, I want to say, a couple years after we started, we were able to get our 501(c)(3, and I think that really helped us build a lot of credibility. But at the same time, we are such a local organization. I started this organization when I was in high school. I was 15 years old. It was literally the midst of the pandemic, and I remember it was literally me and my mom
Oh my
doing
gosh.
everything for the first 2 years. So we do have the 501(c)(3, but we are very local and small.
Yeah, that it does, like you said, it does add to the credibility, and I'm sure it makes getting donations and stuff like that easier as well. So, can you give us a little bit of background? You said you started it in 2015. How did you conceptualize this as an organization, and what needs did you see around you that made you think that it should exist?
Yeah, so it was my sophomore year of high school. So I believe it was literally, officially started it May of 2020. But the way the idea even came to me was that in my life, in general, before this, I had always heard stories of menstruation from women in my own life. I grew up in the US, but my mom, she was born in India. Both of my parents were, and they immigrated to the US literally in the 2000s for their jobs. But growing up, she would tell me how she didn't come from an under-resourced family or anything. Her mom was a teacher, her dad was an engineer, but they simply didn't have period products on the market. And if they were insanely expensive. So what they would have to use was it was like a cloth with cotton in it, and then they would tie it around their waists and tie this knot underneath their pants, and then they'd be biking to school. And then she'd tell me how that was probably the worst part is you're cramping, you're bleeding, you're scared of leaking, and then you have to sit on this knot as you bike to school. And that was so horrible. And then at the end of it, you have to wash it yourself, hang it up to dry, and reuse the same thing. And it was just very undignifying and just not a great experience. Versus, I remember when I got my first period, I was so excited because I was like, I'm finally a woman. It was one of the best days of my life. So just that, seeing that difference for me was, it was like really the first time I heard of menstruation being something negative rather than something positive. And then it was during my sophomore year that I had seen a post on Instagram actually about women in prisons and the struggles that they go through. And so it was things like using the same product for longer than the recommended amount, like multiple days, or using mattresses or bed sheets or things like that, or even subjecting themselves to assault by prison staff in exchange for period products. And so that was really when I saw that this issue isn't just in other countries, it's in the US. And then I researched more about it and saw that it's not just in prisons, but it's in our communities. It's the average person that can face period poverty. And so that's when I decided I wanted to really do something about it because it struck me that it's something that I didn't know about, most people don't know about. It's not really being addressed anywhere. And so I tried to research, and there's a few organizations in the US that do deal with this issue, but they're pretty broad and national, and there's not really very many in the Midwest, especially not in Iowa. And the ones that do, they don't have a multifaceted approach, which is something that we really pride ourselves on. So we do the donating, but we also do advocacy. And so our advocacy is really the first in the state to be doing that.
Which is incredible. I love how you went through that story because your mom can't be very old, right? So that
Yeah,
wasn't that long ago, and
very
that
much not.
might still be the norm in other countries. And I think our age, we don't have to think about it, right? And what a blessing that we can go to the store and pay for those things. But as you pointed out, not everyone, even in this country, can.
Yes.
That isn't something that most of us think about or realize,
And
especially not our male counterparts, especially, I would argue.
exactly. And I do think organizations, when they do think about issues like this, they do focus on other countries and developing countries in the world where it's like those resources aren't available and you think about it. And we're giving so many resources to help it when it's happening in our own backyard and we're
Yeah.
not realizing it.
So when people hear the term period poverty, what do you think that actually looks like in practice within our communities, especially for students and average families?
Yeah, definitely. I think when people first think about it, I think they definitely think that it's something that would happen to other people or a certain type of person, like someone who is maybe low resource, low income, doesn't have the resources to be able to afford them, which, yes, that is a huge problem, is the monetary barrier to these products. But one thing that I don't think a lot of people realize how truly ingrained in our society it is that physical inaccessibility. The average person that has a period, if you go out and about, like you go to school, work, just any business, and you go to the bathroom, you get your period, products are not available. That's your own responsibility to carry them around. And if you don't have it, you don't get to rely on the business or school. You have to ask other people who have periods. So it's that individual responsibility that it's your own fault if you don't carry it around. That's truly the everyday form of period poverty that I think people don't even think about at all. Is you go to school, you get your period. First of all, now you're missing class time trying to find something. If you don't find something, you might be going to the nurse, begging other people, missing more class time, stuffing toilet paper in your pants. And that's a common experience. That's not one or two people. It's almost everyone that can relate to that, and it's something we don't think about.
Yeah, I what struck me is that's similar to food desert, where it's not there is a monetary component to it, right? But
Hmm.
like you said, there's also this accessibility, or if you don't have transportation to places that have it, or you
Yes.
forgot, or maybe you needed more than you thought you did when you left for the day, you're out of luck unless you want to go talk to other people. And there's enough stigma around it that that might also not feel like an option to many people.
Yes. And I definitely think with the physical inaccessibility, it's like we provide free toilet paper, free paper towels, free soap in the bathrooms. And that's for one bodily process that affects everyone. But when it comes to period products that only affects half the population, that's where we stop. And then, like you said, that stigma, it's like a lot of students are getting their period even earlier than we were before. I think I got mine at 11, but our organization, we donate to elementary schools. So it's like students that are in fourth, fifth grade,
Mhm.
maybe even younger, that even maybe at that age, they haven't even been told what's happening to their body. They're getting their period and there's no resources for them. So
Absolutely.
it's basically from that age we're being told that we have to figure it out ourselves and that our needs don't matter, basically.
Yeah. Yeah, I have heard, probably anecdotally though, that people have been getting it earlier and earlier. So when you started this back in 2015, what were the first things that you were doing? What did that look like?
Yeah, we first actually started off, we had to find a place to donate to. I remember. And it was because I had seen a post about women in prisons. I wanted to reach out to a local prison to see if they wanted any. And I remember I called, I don't even remember what, some county jail in Des Moines. And they said they did not need any products. And I was like, I just started a whole organization. And the place that I literally thought would need the most help doesn't need it. And then we had to pivot a lot. We couldn't go back and not do anything because obviously, just because they didn't need it doesn't mean the need wasn't there. So it was after that we decided to actually reach out to community organizations. And our first place that we donated to was actually a youth shelter. And that's where we found our home for, I want to say, the first couple years. It was like 2020, 2021, when it was like still COVID. I was like doing online school at home and we were going around donating to all these places because also at that time it was like these shelters and clinics and stuff. They would tell us how people thought about food, they thought about clothing, they thought about if they thought about hygiene items, they thought about maybe deodorant, shampoo, but period products were what they needed so much of, but it was never donated to them.
That's not super glamorous. And again, I think there's enough stigma that you're not walking in with a box of tampons to, the local shelter or bringing that to a donation drive at work.
Yes. And also, if you're someone in need and you're struggling with this, okay, in our society, it's okay to ask for food and for shelter and to reach out about those resources. But with period products, we don't even have places that you can go. So I think that definitely plays into it. And so we donated to those places for the first couple years, and there was a huge need. And then it was when I went back my senior year of high school, and I was like, how could I have not thought about this? Students and what we go through. Like when you go to school, like I said, you get your period, and it's this whole process. And that's when I was like, okay, let's see. I started donating to actually my own high school. That was our first school that we donated to. And I would say the high school I went to, it is a pretty privileged high school. It is obviously every school is going to have areas that it serves where people are maybe don't have as many resources, but the area we were in, most people had the resources that they needed. So what we weren't, the thing that we weren't expecting was how much we had to donate. We were thinking that it wouldn't be very much, and we were donating every single month because we were running out at our school. And then that's when we realized if this school needs it, what about the other schools in Iowa? And so we started reaching out to, it was like middle schools, high schools, all across Iowa. And we started to really see a need. And I believe it was like October of 2024 or 2023. It was like a couple years ago. It was on the singular day that we got 50 requests from schools all across Iowa. And it was like one of the nurses at one of the schools we had donated to had sent it out to all of the schools that there's this organization, they provide these products. And that's really when the flood came in. And that's when we realized truly how big of a need there is and how much we truly can't support just with an organization.
Yeah. The people can't see, but my mouth was hanging open when you said 50 schools in a single day.
Yeah, it was crazy.
So, a couple of follow-up questions. In those early days, when you said that you were donating, how were you getting these products? Were you paying for them out of your own pocket? Were you getting them from your community? How were you getting these donations?
Yeah, so I will say the first couple years it was very much grassroots fundraising, just asking friends and family if they can donate, but obviously you can only do that for so long. But we did a chicken wing fundraiser one year, which was really fun, but that really only brought in so much money. And we would buy the products. I remember we first started off buying them from Costco, thinking that's where you can get them for really cheap. And we realized truly how expensive the products are. And we still to this day don't get wholesale price. We buy our products at retail, so we get them pretty expensive. But we were able to find a product that is a little bit cheaper for us. But yeah, it was literally like we're buying it from the store, retail price, getting donations from friends and family. And that really could only sustain us for so long. And we slowly started getting deeper into fundraising and applying for grants. And I will say fundraising is very much still one of our biggest challenges because a lot of people or a lot of grant places that give out grants, they some of them have requirements for their grants. And it'll be like certain areas that they want to support, like STEM, housing, financial literacy, things like that, where period poverty can't even be tied into that. And so there's so many places that we can't even apply to because it's our issue isn't even thought about as an issue to support.
which is crazy. So you kind of talked about this because this is going to be one of my questions. What type of products are you buying? What do you buy in bulk? And then once you get these products and you're giving them to schools, where do they go? Who puts them out? Where are they housed? And how do people access them?
Yeah, so we buy pads and tampons. We buy the disposable kind. A few people have reached out to us and asked if we'd ever think about switching to sustainable products. And our philosophy on that right now is that sustainable products are amazing for the environment, but if you are someone who's experiencing period poverty and you don't have access to clean water to keep that product clean or a place to clean your products, that turns into another cycle of period poverty where that product is not serving you in a way that is healthy for you. So we try to do quality products like quality pads and tampons so that they're not uncomfortable and low quality where it's itchy, uncomfortable, undignifying. We think that you should be able to have the product that you need. And we try to do a variety. So when we donate to schools, we either, if it's a place that's in a rural area where we can't necessarily drive to, we send them products in bulk. And if it's a place that we are able to drive to, we'll sometimes send them period packs, which is like a Ziploc with it's a mix of pads and tampons in a variety of absorbencies so that students can have access to different types of products and it's not just a one size fits all type of thing.
So then once they get to schools, where are
Mhm.
they kept in schools? How do students access
Oh yeah.
them?
Yeah, so we ask schools to try to keep them in the school bathrooms because it defeats the purpose if they're not in the bathroom, where students are still having to go ask for it and find it and yeah, just go out of their way to try to get a product. So we really try to ask schools to put them in the bathrooms in an accessible place and we have signs that they'll put up that say if take what you need for now and if you need more for home, you can go to the nurse's office and get a pack for home. So it's addressing both the immediate need and the longer term need if there is one.
Yeah, which kind of leads me into my follow-up question. Do you ever get people saying that if you put them out in bathrooms or something like that, that people are going to take advantage of it? And if so, what is your response to that?
Yes. We have had people say, oh, if you put them in the bathrooms, people are stealing them, they're taking all of them. And our thing is, okay, that's good. That means okay, if all of them are getting stolen, reach out to us, we'll send you more. And because it's obviously people are not stealing these products just to play around with them. There's been a very, very few number of instances with some schools where, okay, it's middle schoolers in the bathrooms, they're messing around with them, sticking them on the walls, on the toilets, things like that. But that is a minority, a very small minority of schools. And with that, it's okay, they'll mess around with them for a little bit. And then once students realize the purpose of these products, and if it becomes normalized the same way having paper towels and toilet paper is in the bathrooms, people won't mess around with it. Yeah, just because people are taking them, it doesn't mean that's a problem. If anything, that's solving the problem.
I love that answer. And I think even middle schoolers putting them on walls, probably not exploration, but normalizing them and making them accessible. And okay, you take one because you want to try a different brand or you don't have access to tampons at home. I think there's more than just taking one when you need it in that moment. There might be some value in having access to different kinds of products that you wouldn't normally get. That's like maybe you do have some at home, but there is some value in this other kind. Yeah.
Definitely.
So from there, you started supplying to schools, and then eventually what started as a community organization or project has now grown into a 501(c)(3) nonprofit that serves schools and organizations across Iowa. At what point did you realize that this was a lot bigger than just a community effort?
Yeah, I definitely think it was once we actually started donating to schools and we realized there was that huge need because that thing of 50 schools reaching out to us in a single day has happened a second time this past fall. And it's truly a need that keeps growing faster than our organization can keep up with it. So with these schools, it's like we truly just don't have the capacity to provide for all of them at the same time. So we have a wait list of a ton of schools that are like literally waiting to get products. And we have to prioritize them by if it's a school where staff is spending their own money on products, if they have no other resources or donations for products, they are our highest priority. And then if you're a school where your staff is still spending money, but maybe you are able to get by a little bit with a few donations from here and there, you are next on our list. But it's the fact that all of these schools are so high need where literally staff is spending their own money, personal money on students to provide these products. And that's where we started to get into our advocacy. And we've actually been advocating for the past 4 years now in the Iowa State Legislature. And we've been advocating for bills that would basically make it free. It would be like a funded mandate for Iowa schools to have to provide these products in the school bathrooms while also it being funded by our state.
A big part of Love Red's work is advocacy and education beyond just the product distribution. So, when did you realize that was really important, and what does that look like, and what has it looked like over the course of the organization?
Yeah, so when we first really realized that advocacy had to truly be a big part is when we saw how big of a need that there is for these products for schools and how much that our organization cannot just support everything. And
Mhm.
we truly believe that donating products is super important, but it only alleviates the issue and it doesn't solve the core problem. So that's when we started doing advocacy. It was my freshman year of college. And that was also when I did my first day on the Hill, and it was when I was teaching everyone how to advocate at the legislature. But we've something that I've found is just learning about advocacy and policy is learning how disconnected it is from the general public sometimes, or how hard it is for the general person to understand how it works and how inaccessible it is. And so we worked on that to make our Day on the Hills for everyone. And we do training sessions before our Day on the Hills to teach people how to advocate, how to talk to your legislators, how to reach out to them, things like that. Because it is so important to be able to bring these issues up. Because, like I said, our organization is bringing awareness to an issue that really hasn't been talked about in the legislature before. And it was last session, actually, that one of the bills that we were advocating for made significant progress through the legislature and it passed through the education and the appropriation subcommittee in the House. And that I think was like the most progress a bill related to this issue has ever made in Iowa. So that was so insane. This year, we were really hopeful something would get passed. We're not 100% sure if anything got passed. The session ended, I think it was like a few weeks ago, but we haven't
Yeah,
gotten
like
news.
2 weeks ago.
Yes, we haven't gotten news if there has been anything with our advocacy goals yet, but hopefully there is, but also we also understand how long of a process advocacy can be in getting policy change, but it has been a crazy experience just learning how everything works and helping other people as well. And we have students, volunteers, members all come to our Day on the Hill to be able to talk to legislators, which is really cool.
Yeah, if people haven't ever been to whatever their state capital is, obviously here in Iowa, it's in Des Moines. It can be a completely overwhelming experience. And
Mhm.
while it, like you said, it's supposed to be accessible to everybody, there's a lot of behind the scenes parts to the process that you have to know and understand. But I think once you get there, You realize that your senators and legislators, especially at the state level, are just like you and me, and that they
Yes.
are approachable and easy to talk to, but it's understanding the lingo and how to get in there. And then once you're in there, how to be effective. That
Yes,
requires some training, and that can be relatively inaccessible. But once you do, it's not so scary.
definitely.
I think you made a good point about the process being really long, especially when you're starting from like the beginning of like education about there's most of them probably didn't even know that period poverty or whatever that looks like here in Iowa existed in Iowa. So not
Yeah.
only are you having to educate them about a problem, but then you have to show them why it's important to them and show them the solution. And you have to do that for every single member in order to get it through. So
Yeah,
big process.
definitely.
You've worked with schools and legislators and community organizations. From your perspective, where are systems currently falling short when it comes to menstrual product access?
I definitely think that because of the stigma, it is something that even areas where we provide resources to people in need, it's just something that isn't thought about and talked about. And it's truly not a fault of one person or one system. It's like a society-wide stigma that is ingrained in every part of our lives. And so I think it's truly everywhere, like from places where if people need resources where they can get it, to those places not being able to provide these products, to even the average person where in our daily lives we have to carry around our own products. It's like it truly falls short everywhere, and I really do think this issue is something that the solution is so long overdue. And it's as a society, we're growing so much and advancing in so many ways. Something like menstruation that is so basic in a way where it's like such a basic need for a person, for that to be unfulfilled for so many people, whether it's like emotionally, physically, mentally, or just like in that sort of way, like it's just something that's so overdue and like I think in general our society falls short as a whole. It's like all around the world. And so I think just truly just starting the conversation on this and making it more normalized, not being scared to talk about periods, talking about it to everyone, to your dad, to your brother, to guys in your life, to women in your life. When we have like community events and like festivals that we go to during the summers, and we'll have booths at these places where we do like period trivia and like a spin the wheel and things like that. And one thing we notice a lot is we'll see like families where there's women or even little girls, they'll come up, they'll see it's about periods and turn the other way. And it's just crazy to think that happens in the 2020s, like in this day and age, that stigma is still there, that it's like with this issue, we have to start from the very beginning to get it solved.
Yeah, absolutely. And I don't think we've even touched on pink tax, but that might be something that people have heard that are listening to this, and that's the idea that these products are taxed and only people who menstruate have to pay
Mhm.
that tax. And so I think that kind of falls in here too. It's so baked into our system that there's this kind of inequity around this and stigma around it that yeah, there's a lot of ways that we could attack this problem and a lot of different avenues for that. I wanted to ask one follow-up question that I'm realizing I didn't ask about legislation. You said that there was a bill that got the farthest it's gotten in Iowa. What
Mhm.
was the bill, or what are you advocating for change-wise in Iowa?
Yeah, so our bill, it was for this past session and the session before, it used to be HF 543, and then once it got into the Appropriations Committee, it changed to HF 883 because it turned into a budget bill. But it was basically a bill, and it was mirrored off of other states that have done this, but it was a bill that would make period products, they would be required to be in school bathrooms, like X number of school bathrooms in a school. I believe this one was for grades 6 through 12. And then it would also fund them for the first 3 years that they're
Hmm.
required. And so that way they're being funded and then they can slowly be incorporated into a school's budget. But our goal is also that there would be other funding for this for schools that can't afford it. but it would provide the support and the mandate so that it removes the barrier for students and it takes the burden off the staff to provide these products. And it's truly a first step to get these products be accessible for everyone.
And did you find that the legislators and senators that you talked to were amenable to this?
That's something that was actually very surprising for us. I think in the Iowa legislature, we were expecting this issue to maybe not be taken seriously, but we found that a lot of legislators did agree that this was a problem. They even had their own experiences. There was a legislator who talked about how his wife suffered from toxic shock syndrome and things like that. So it was something where they truly did believe that this was an issue and that it should be solved. It was just a question of should it be solved by the legislature? And with money, that's always a hard thing of how much will it cost? Who will pay
Who
for
pays?
it? Yeah, that sort of thing. So I think it's those kind of logistics that kind of make it a bit harder.
Yeah, and that takes a couple of years to get ironed out.
Yes, definitely.
You've spoken publicly about wanting period products to become as normalized as things like toilet paper in public spaces. What policy or system changes do you think are most needed to get there?
Yeah, I definitely think that it needs to be that everywhere we go, like the same places that provide toilet paper and paper towels, we need to start providing period products for free. It shouldn't be that I need to put a quarter in to get this product. And I remember there was like a school where a student had done some project on period poverty. So they had taken one of the dispensers in the bathrooms and opened it, and the products inside were expired for 20 years.
Oh my
So
gosh,
it's
that's because no one carries around a quarter anymore.
yes. And especially students, they're not carrying around change. They're not, and like the machines don't take Apple Pay, and they don't even have Apple Pay.
I couldn't buy
It's
anything if it didn't take Apple Pay.
exactly. And so it's just so inaccessible and not modernized in that way, where it's like almost like a gumball machine. You need a quarter to put
Hmm.
in, which no one is carrying around. And if you don't have that, you don't get you don't get it. Your resort is toilet paper or asking someone else. So I think just starting to care more about menstruation and what it's like for a person to be menstruating and to be active in the world. It should not be something where when we're on our period, just having access to products is something that's stopping us from being able to experience life and the things that we want to do. And it starts with being able to have access to these products when we're out and about.
Yeah. And I think if people are listening to this, if you own a business, not maybe easy, but if, a step that you can make if this resonates with you is stocking the bathroom that you're responsible for, whether that's at a school or at your business, that type of thing.
And if there's people that are at schools and they need products, our website has a donation request form that people can fill out and we'll get back to you. And if we're able to support you, we'll be happy to send you period products.
As we're wrapping this up. So, number one, if this message resonates with people, how can they connect with you? If they need products, if they're interested in supporting your mission, what does that look like?
Yeah, so our website is www.lovefored.org. We're also on literally every social media platform you can imagine, and we're at loveforred.org on all of these platforms. So you can follow us on there. And if someone wants to do something with us, partner with us in some way, be a part of our organization, they can reach out to us. You can probably do it on our website, but our email is loveforred.org@gmail.com. And yeah, they can just get in contact with us and they can also look out for our future events. We actually just had our Day on the Hill last month on April 8th, and that was really fun, but we do it every year, so people can look out for next year, our 2027 Day on the Hill. But we'll also have summer events. We also have a student ambassador program for students that are at the schools that we donate to, and they're the ones that are taking care of the school's menstrual product need, putting the products in the bathrooms, being a liaison for us, things like that. So if anyone's even interested in that, they can reach out to us. But yeah, we're really open to anything. They
So
can just
many ways to
us.
connect.
Yeah.
So, my last two questions are first off, what does it take logistically to run and sustain a nonprofit like this, especially while balancing school and other responsibilities? Started this in high school. You're now going to be graduating from your undergrad. How did you do all of that?
Yeah, I will say this was only possible with my support system and the team that we have at Left for Ed. My mom actually does a lot of stuff in Des Moines. She takes care of our Des Moines operations. She's our Des Moines operations director, and she's been truly instrumental and so supportive of this and helping make Left for Ed so much more than it was at the beginning. And we also have a team, a leadership team, and a board of advisors of I think it's now six. It's like these six very amazing women from the Des Moines area who are in all different aspects of everything. We have someone who used to be part of the Des Moines Register as a editor or the columnist. We have a business owner, an OBGYN, a lawyer, all of these truly amazing women who do so much for the community in Des Moines, who are like dedicating their time to also be part of Love for Ed. That has been so instrumental to help us grow. And then all of our volunteers, they've really helped. We have an Iowa City team and a Des Moines team, so both of them have really helped. Delegating work is a really good thing to do. So that's really helped a lot. But yeah, it's truly the team. It's like everyone involved. It's definitely not just me.
I love it. It does take a team. Teamwork makes the dream work.
Definitely.
Final question. Looking ahead, you are graduating. What's next for you? And then also, what's next for Love Red? What does the next 5 years look like?
Yeah, a lot of it with Love for Ed has been us figuring it out as we go. So I think that'll be part of it with the next 5 years is just seeing where we needed, what ends up happening. I think a lot of it is dependent on if this problem, if we're able to get it solved for students in schools, what's the next avenue, what's the next place that people are in need that we can solve in Iowa. And then, yeah, personally, I'm also applying for medical school this summer. So that'll be a huge experience. And yeah, I hope to be a physician and I'm really interested in women's health. But my view on it is I think women's health is really tied to reproductive health, but I think it's so much more than that. And I really want to be a doctor that really focuses on women's health as the ways that it isn't addressed right now. There's so many things of there was like a study done recently on how heart attacks are shown differently in women than men, and it's because our hearts are different. A completely different system. There's so many parts that are just so different, and it's things like that where women's health isn't researched. It needs to be researched more. There needs to be more done on it, and I think we need also doctors that have that view on care.
Yeah, absolutely. Sounds like you're going into the right field then, and we need more people like you.
Thank you.
So, as we wrap this up, I want to thank you for taking time today to chat with us and to share about your organization and how it came to be. And I'm leaving feeling really inspired about people like you doing really cool things out in the wild. So, thank you for chatting with me. Thanks for sharing your story. And if anyone wants to connect with the organization or you, I will put all the information in the show notes.
Sounds great. Thank you so much for having me.
That's it for episode this week. A big thank you to Maanya for joining me and sharing the story behind Love for Red. Today's conversation is a reminder that public health challenges are often hiding in plain sight. Access to menstrual products affects education, dignity, health, and opportunity, yet it remains an issue that many people never have to think about. Whether it's supporting local organizations, advocating for policy change, or simply helping reduce the stigma surrounding menstruation, there are meaningful ways each of us can contribute. This episode was hosted and written by Lauren Lavin and edited and produced by Lauren Lavin. You can learn more about the University of Iowa College of Public Health on Facebook. Our podcast is available on Spotify, Apple Podcasts, and SoundCloud. If you enjoyed this episode and would like to help support the podcast, please share it with your colleagues, friends, or anyone interested in public health. Have a suggestion for a team? You can reach us at cph-gradambassador@uiowa.edu. This episode is brought to you by the University of Iowa College of Public Health. Until next week, stay healthy, stay curious, and take care.